Hello and welcome everyone. This is episode 4 of Urgent Care Stories. Today's episode is called Never Trust a Woman, and that's for one very specific reason. So let's get into this case. So this was a 23 or 24-year-old female. She was healthy medically, no chronic medical problems. And she came in with a 2 to 3 day history of right upper quadrant belly pain. So she's a little overweight, and she says that the pain is kind of all the time. It's been progressively worsening for the past few days. She denies fevers or chills, denies pain when she pees, flank pain, constipation, diarrhea, nothing like that. And she says that she's on her period right now. So when somebody comes in with right upper quadrant belly pain, the first thing that you're thinking is acute cholecystitis. So the gallbladder is infected. They call it the 4 Fs. It's female, 40, flatulent, and fat. So that's kind of the population that you typically see this the most in. The history that you're typically going to get with a acute cholecystitis is somebody who comes in with right upper quadrant belly pain, worse after meals. They start to have fevers, jaundice, yellowing of the eyes or skin, nausea, vomiting, that sort of thing. In those patients, you want to either get an ultrasound or a CT scan to confirm the diagnosis of acute cholecystitis, and that is a surgical diagnosis, so you have to send them to the hospital for admission. So this lady comes in and we push on her belly, and she's got a little bit of soreness, but there's a negative Murphy sign. She has no rebound tenderness. So I say, well, let's do a little bit of a workup and let's kind of go from there. So when I ask her about her period, you know, everybody that comes in is childbearing years, you want to consider pregnancy. And she says, well, you know, I've been having my period for the last couple of days. It's a little earlier than normal, but, you know, it's supposed to happen about this time. So I say, okay, it sounds good. So I decide to do kind of some blood work up for this woman, and then also get some sort of an imaging. And so because she had private insurance, a CT scan was going to be hard to obtain. So we decided to just do an ultrasound of the right upper quadrant. So I ordered a complete blood count, a basic metabolic panel, a urinalysis, a urine pregnancy test, and then we're going to do the right upper quadrant ultrasound. So her white count comes back on the CBC. She has a normal white count. There's no leukocytosis, so that further reduces the likelihood that this is acute cholecystitis. Her urinalysis is clean except for a little bit of blood, but she said that she's on her period right now. There's no bacteria, nitrite negative, so we're not think this is a urinary infection issue. The pregnancy test ended up being positive, and we checked it twice, and she was in fact pregnant. Now this is a woman who had no idea that she was pregnant when we tested her. So we got the results of the pregnancy testing while she was over an ultrasound. So I decided to go ahead and get a pelvic ultrasound as well. The right upper quadrant ultrasound came back clear. Negative ultrasonic Murphy sign, gallbladder is visualized, no stones, no wall thickening, completely normal right upper quadrant. The vaginal or pelvic ultrasound that we performed showed that she had a twin pregnancy in the uterus going on. So it turns out that this young lady had a threatened abortion of a twin pregnancy that presented as right upper quadrant belly pain. And she thought she was on her period. So this was kind of an awkward situation to have to go into this room and say, I've got some information I need to tell you, because I didn't tell her any of the results of the blood work or anything until I have everything back, and I wanted to make this conversation one time. The young girl is not married, she's single, she's got her mom in the room with her. So I come in and I say, hey, I've got some stuff I need to tell you, and some of it is personal. Would you like to have mom step out of the room? She said, no, it's fine. You know, you can tell me. So I said, well, the good news is your gallbladder that we were worried about is totally fine. There's no infection there, nothing that needs surgery right now. The blood work all came back looking normal, but your pregnancy test was pregnant right now. And when we did the pelvic ultrasound, it shows that you have a twin pregnancy. So 2 babies in the uterus right now. You can see the look of shock on the patient and on the mom. This is a woman who is, you know, single, had a guy she was fooling around with, I guess, and thought she was having her period just a couple days early, but it turns out that she was having an early miscarriage, or what we call a threatened abortion. So when a woman is pregnant and she starts to have vaginal bleeding, that's very concerning, because sometimes that can become a abortion or a miscarriage where they can lose that baby. So at this time, we do a pelvic exam because we want to look at the cervical odds. We want to see, is it open? Is it closed? You know, do we see fetal tissue on the pelvic exam? That's an important thing to do. Her pelvic exam was good. There was a small amount of blood coming from the cervical odds, but it was closed. So at this point, we say, hey, look, we need to get you into an OB as soon as possible. And from here, it's a maybe, maybe not. There's a chance that you could have a miscarriage and you could lose the babies, but there's also a chance that, you know, you might still have the pregnancy. And so I said, no smoking, no drinking. You know, if you start to develop fevers, vaginal discharge, worsening pain, anything like that, go to the emergency department right away. But at this point, we're just going to have to kind of watch and see what happens, and then get you in with the OB and have them decide if there's still a pregnancy going on. When we followed up with this girl a few weeks later, she ended up losing both of the babies. It was a miscarriage that she had. So, you know, I don't know if she was happy or sad about that. That's not really my place to say. But the point of telling this story is, I have had several catches like this where young women think they're on their period, but it turns out that they're pregnant and they're having a threatened abortion. And so anytime you have somebody with belly pain, female of childbearing years, always get a urine, always get a pregnancy test. If you think they have a bladder infection, always get a pregnancy test, because they'll tell you all day that they're not pregnant or they're not sexually active or, you know, X, Y, or Z. Oh, I always use protection, blah, blah, blah. But they can still get pregnant, and it is your responsibility to make that diagnosis if it's there. So, that was an interesting case. It's a lesson that you hear a lot in school, you know, always get a pregnancy, but I can confirm in reality, you need to get a pregnancy on all of these patients. So that was the lesson from that visit, and I think it was just an interesting case that depicted that. Exactly why she had the right upper quadrant pain, I don't have a great answer for you. It did not have a history that suggested acute pancreatitis or ulcerative colitis or any peptic ulcer disease or GERD or anything like that. I know that there is a finding called Fitzhugh-Patrick or Fitzhugh-Curtis sign, I believe, where you can have referred pain to the right upper quadrant. You typically see that in endometriosis. But you know, that was kind of my thought, is that maybe she's just having referred pain to the right upper quadrant related to some sort of inflammation going on within the pelvic organs. Luckily, they did not see an ectopic pregnancy. They did not see a tubal ovarian abscess. She was not having vaginal discharge. We know that her urine was clean, so there wasn't any need to put this woman on antibiotics right now. It was really just close follow-up with OB. Hope you guys enjoyed this episode. Let me know if you like the horizontal view of these videos better. I'm happy to film them either way, so just leave me a comment if you like this approach better. And we will catch you guys in the next episode. Thank you very much. Bye.